Hi, good afternoon, everyone. I'm delighted and honored to have Charlotte Collins, Senior Vice President of Policy and Programs for the Asthma and Allergy Foundation of America, Carolyn Moassessi from the Great Wolf Foodie blog, and Larissa Kaczaniuk from who's AAFA's Advocacy and Outreach Manager, who will be joining us here for today's webinar. This webinar is offered by Kids with Food Allergies as part of its educational outreach program. I'm Linda Mitchell, Vice President at the Asthma and Allergy Foundation of America. I lead the Kids with Food Allergies division. I have the privilege of being your moderator again today. Guest presenters for all of our webinars are doing so as volunteers without compensation. On behalf of KFA, I'm very grateful for Caroline to donate her time to be here with us and for Larissa and Charlotte to be here joining us as AAFA staff. I have a few housekeeping details to run through before we get started. First of all, today's webinar is made possible through a sponsorship by Mylan Specialty. We rely on donors and corporate partners like Mylan Specialty for the financial support that enables us to develop educational programs for families. Next, please remember that this webinar is of a general nature only and is not medical or legal advice. You need to consult your own physician or attorney for any advice you seek with regard to food allergies and other conditions. Today's webinar, as always, is being recorded. We will send you a link to the recording in a few days. And later in today's webinar, we will stop to give away some wonderful gifts from our corporate supporters, 2 gifts from Sun Butter, 3 from Libre Naturals, and 2 winners from Pascha Chocolates. The recipients of these gifts will be picked randomly from those still in attendance later in the webinar. And when we end the webinar, you will see a survey, and you can take that survey and let us know how we did so we can improve the future direction of our webinar series. So what I'd like to do is put up a few polls for you to take while I introduce the speakers, and then we can get started. First is Charlotte Collins. She's an attorney and a Senior Vice President of Policy and Programs for the Asthma and Allergy Foundation of America, or AAFA. Before joining AAFA, she was an Associate Professor at the George Washington University School of Public Health and Health Sciences, and she taught graduate courses in public health, law, policy, and management. Ms. Collins received her law degree from Georgetown University Law Center and is a former counsel in the healthcare policy practice in a Washington, D.C. national law firm. For over a decade, she worked with advocates to expand health coverage for the uninsured in the state of Tennessee, acted as a general counsel, and ran government relations for a safety net hospital in Memphis. Collins directs AAFA's state advocacy promoting access to epinephrine in schools, and she authors AAFA's annual state honor roll of asthma and allergy policies for schools. She serves on the coordinating committee of the National Institutes of Health National Asthma Education and Prevention Program and the Public Policy Committee of the American Thoracic Society. In 1995, Charlotte won the Nelson Mandela Award for Health and Human Rights from the Henry J. Kaiser Family Foundation. In April 2006, Modern Healthcare magazine named Charlotte as one of the nation's top 25 minority healthcare executives. Carolyn Moassessi is the co-founder of the Nevada Food Allergy and Anaphylaxis Alliance and currently is the author of the food allergy and asthma blog site Grateful Foodie. She's active with the food allergy and asthma patient community as a parent and patient advocate. She was the lead advocate for mandated stock epinephrine in the state of Nevada, which is the 4th in the nation to mandate the stock epi carried in schools. She currently sits on the American Lung Association's National Social Media Workgroup. She's the past National Advocacy Workgroup member and is a past Secretary and Treasurer for the American Lung Association of the Southwest region. She's the past Chair of the Board of Directors for the American Lung Association in Northern Nevada, and she also co-founded the nonprofit Northern Nevada Asthma and Food Allergy Parent Education Group and serves as its president. In addition to all of that, she's a founding member of the National Allergy and Anaphylaxis Council. Carolyn has a degree in hotel and restaurant management and has traveled the world as a trainer in the industry. She lives in Reno with her husband and 2 children, and she's a real dynamo, and we should have fun listening to her presentation. Larissa Kaczaniuk is the Advocacy and Outreach Manager at AAFA. She manages the organization's public policy campaigns, and in addition to coordinating outreach to advocates, patient speakers, and AAFA's network of educational support groups. She has a bachelor's degree in behavioral and community health from the University of Maryland, College Park. So after all that, I would like to thank Carolyn, Charlotte, and Larissa for joining us here today. I welcome you to go ahead and get started. And Charlotte's going to go first and review the polls. Thank you. Let's see, Charlotte, are you unmuted? There you go.
Okay. I am now unmuted. Hi, everyone. This is Charlotte Collins, and I am going to begin by reviewing the polls. Thank you very much, Linda, for your introduction. And the first quick poll question is, my child's school stocks epinephrine auto-injectors, and the poll results are before you. And let's see. All right. I actually lost it on the screen momentarily. Here we go. Great, great. So we can see that predominantly you're not satisfied. 65% of you who answered said you were not satisfied, and only 16% said yes, with 19% not applicable. So we'll move to the next question. Quick poll question, which is, how many of you have contacted a state official about food allergies and anaphylaxis before? And I see about the same percentage of you, is that a coincidence, have never contacted a state official about food allergies and anaphylaxis. 65% have not, with about 16% of you having done it 5 times or more. Next question. I'm sensing a pattern here. The next question, I am aware of the steps I need to take to change or improve policies at my school, and 29% of you indicated that you are and said yes, and 42% said no. So with 21% of you saying you don't know and 8% not applicable. Okay, so I think that we really have, this is interesting to me because it indicates that most of you are going to be interested in the information we plan to share with you today, and particularly in some of the questions and answers we plan to discuss as a panel after we have our introductory remarks. In 2008, I joined the Asthma and Allergy Foundation of America primarily to advocate for the needs of children. And since joining AAFA, one of the most striking gaps that I've seen in children's policy is the one that I suspect, and maybe the polls have confirmed, that many of you faced. How do you protect your children with food allergies and other allergies when they are outside of your direct control? And that's so much of the time, especially when they are away at school during the day. You can educate them to avoid those substances that trigger those allergies, and that works up to a point. Yet what happens when they are at school and avoidance does not work? Next slide. What can happen are preventable injuries and even deaths. For example, in the days following the winter break of 2012, a little girl in Virginia who had a known allergy to peanuts shared food with another child on the playground. She had a reaction, and according to her family, the school didn't have an auto-injector to administer to her, so she didn't get the benefit of this epinephrine treatment. Eventually, she died. The good news is that by April, a mere 3 months later, the Virginia legislature passed a law requiring schools to keep these epinephrine auto-injectors on site for emergencies like these. We ask ourselves, why does another tragedy like the one in Utah that's also noted on this slide that happened in 2013, why do these tragedies have to happen before states take action? But there's more good news. Many states are taking action, and it's because of the efforts of advocates. What it takes is pure, committed, passionate advocacy by parents and others who live through the anxiety of having children at risk spending much of their time at school. These advocates have pushed laws similar to Virginia's law. They require or at least allow schools to stock epinephrine auto-injectors and train school staff to use them in an emergency. Next slide. Okay, this chart summarizes the key provisions of these state-level proposals. Some of these laws may vary, but they all attempt to set up a framework under which schools can acquire, keep on hand, and assure that someone can administer epinephrine auto-injectors responsibly. Some laws extend this important point of access beyond the schools to allow other facilities to stock medication for these emergencies. For instance, Michigan has a pending proposal that will allow entities like restaurants, recreation camps, youth sports leagues, amusement parks, or sports arenas to stock epinephrine auto-injectors. Next slide. As a result of strong advocacy, virtually every state gives students the right to carry and use epinephrine auto-injectors on themselves. New York is lagging. There is a law, however, that's awaiting Governor Cuomo's signature. But the right to carry and self-administer is just a start. What about the kids who have their first allergic reaction while at school and don't have a prescribed epinephrine auto-injector? The big news is that advocates have been winning, and over 40 states now have at least a law that allows schools to stock epinephrine. However, AAFA will not rest until all states require schools to stock the life-saving medication. Now only 9 states require their schools to do so, and they are listed here. 2 of them are especially interesting. California, which passed a law allowing schools to stock epinephrine, and then improved this law by passing a new law that requires schools to stock epinephrine. And as I understand it, and some of you might note that if you know this law really well, there are holes in this law, and it's not 100% of what we would want to see, but it does represent progress. This was a tough battle, and our speakers will share some highlights. Keep in mind that flipping the states that allow into states that require epinephrine stocking in schools is a looming challenge for advocates in 2015 and beyond. I mentioned 2 states. The second state that is interesting is Nevada. Next slide. So this afternoon we're going to hear a first-person account from Caroline Moassessi, a national blogger and leader of the successful Nevada effort. And following Caroline will be Larissa Kaczaniuk, who's again already been introduced and is our AAFA's Advocacy and Outreach Manager, and she's going to talk about using AAFA's Action Center to help power your activities. And afterward we'll have ample time for question and answer and discussion with our speakers. But before Caroline takes the mic, I'm going to close my remarks with an exciting announcement. Next slide. AAFA has produced a new toolkit for advocates. It's called Making an Impact on Anaphylaxis. This is a toolkit for advocates, and we designed it with the 2015 state legislative sessions in mind. 2 experts helped to write this guide. Caroline, whom you will meet in a second, and Michael Hackett, her colleague and a government relations expert, and both are fresh off of their big wins in the state of Nevada. Next slide. We think that you will find this toolkit useful whether you are new to advocating for laws or even if you're more experienced. In my case, I've been at this for a really long time, and I learned a lot from this toolkit already, particularly about being organized using social media and planning campaigns. If you want it, we want you to have it, and thanks to a sponsorship from Mylan Specialty LP, we are offering it to you. we will distribute it via AAFA's Action Network. If you are already a member, you will receive an email from us in mid-November with a link to the downloadable version of this toolkit. If you are not already a member, all you have to do is sign up to be a member using the URL that's listed here, or alternatively, you can email us at advocacy@aafa.org. And just to show you where it is on the web page, next page, if you go to the web page URL, this is the home page for our advocacy portal. You'll see this page, and just click on the button on the top right of the screen to join our Action Network. It's that easy. And with that, I'd like to turn the mic over to Caroline Moassessi. Okay,
Carolyn, can you unmute yourself? Thank you. Caroline, can you unmute yourself? Hi, everyone. I think Carolyn's having a problem herself, and so what I'd like to do is ask Larissa to go ahead and give her part of the presentation, and we'll let Carolyn work on her audio settings so that she can join us after Larissa is done. Thank you, Larissa.
Okay, hi everyone. So today I'm going to be talking a little bit about AAFA's Action Center. And what the Action Center is it's part of our website where you can find information on the different policy issues that we're involved in. And the nice thing is it's also a place where you as advocates can get involved with those issues as well, because it's a little bit more interactive. And what you're looking at here is the home page, and as Charlotte mentioned, there's the Join Our Action Network button over on the right-hand side. There's a lot of general information, and so today I'm just going to talk about the different features of the Action Center and what you can do while using it. Next slide. Okay, so the link to access the Action Center is aafa.org/engage, and there are a lot of different features. For example, you can find your elected officials. All you have to do is plug in your zip code, and it will just generate a list of your elected officials, and it'll give you quite a bit of information on them, including their contact information, how you can best get in touch with them. It will give you directions to their website. Using the Action Center, you can also track state and federal policy issues by bill number. And you can take action by contacting your legislators about specific bills or policy issues. Another thing that we sometimes do is we'll ask advocates to share their personal stories and experiences, and then we'll just post those stories on the Action Center. And on the right-hand side of the page here, you can see the key issues that we work on, and each of these issues have their own individual pages on the Action Center. And if you go to those pages, you can find information on the issue, current events, you can find our positions, and you can find the different action alerts that we'll post on those issues. Next slide. So this is just a screenshot of one of our issue pages, and this is the epinephrine in schools page. You can see the action alerts are at the top of the page. So the action alerts we post here will be about a specific bill, and since this is epinephrine in schools, it's usually a state bill allowing or requiring schools to stock epinephrine. There's epinephrine in the news. We have a few different things on this page, including the map, and if we go to the next slide, we can take a closer look at this map. Alright, so here is our map that shows the status of epinephrine stocking laws across the country. And as you can see, a clear majority of the states now allow or require schools to keep a supply of auto-injectors for use in emergencies. And the states that have a yellow star are the states that require epi-stocking, and the light blue states are those states that are currently considering pending legislation. And we're actually hopeful that soon we'll get to see Pennsylvania turn dark blue because we are currently waiting for the governor to sign legislation that has been recently approved. Next slide, please. Okay, so when you take action on an alert, this is what you will see. You'll be asked to put in your information, such as your email and your home address, so that the system can kind of determine who are your legislators and who they should be targeting with the alert. So after that, the website will take you to this page where we'll have a preloaded message that you can send to the legislators who are the target of the alert. Oftentimes, we're asking the target of the alert will be your individual legislators, but sometimes if there's a specific bill that is with a certain committee, we will preset the target. So usually you'll see your own individual legislators, but occasionally there will be a preset target, so everyone who takes action on the alert will be sending a letter to the same legislators. And so you can actually usually edit the letters that we supply. A lot of advocates like to put a little personal touch in, kind of their own story, make it a little bit more personal before they send it to their legislators. And so for example, on this alert, this was a letter that we sent in defense of funding for the CDC's National Asthma Control Program. And I plugged my information in just to give you this example. So it selected my senators, which are on the right under recipients. And again, I could edit this message and kind of put my own story in there if I wanted to, or you can send it just as it is. So it's very simple. It's extremely easy. It really only takes you a few minutes, even less if you're not going to edit it. Next slide, please. Okay, so I mentioned this earlier, but I just wanted to point out this tool that you can use to find your elected officials. It's located at the bottom of the home page, which I've highlighted in red, and you can also find tools. And I just think this is a really, really helpful thing because even if there's something that you want to contact your legislators about that we don't have an action alert listed, you can use the Action Center to kind of find their information, to learn more about them, to learn their policies, to find their website. So it's really great, and I just recommend that everybody go and plug in your zip code and just kind of see who's representing you. Next slide, please. Okay, so as Charlotte mentioned earlier, and I know Caroline will get into this a little bit too, we recently had success with a bill in California, and I just wanted to kind of mention how our Action Center played into this passage of this law. So California recently passed SB 1266, which was a mandated epinephrine stocking law. So it requires schools in the state to stock epinephrine. I know there is a little bit of a loophole in that there is a requirement that there be a trained volunteer on site. So I think if schools don't have a trained volunteer or if they don't have a school nurse, they can kind of get out of that requirement. But we did post an action alert on SB 1266, and it was live on our website from February until August of 2014. So it was up there for about 6 months. And of course, the action alert target, meaning the legislators that we were messaging, did change as the bill progressed through the legislative process. Initially, we were targeting the senators, different committee members, and then the bill went to the Assembly. And so over the course of those 6 months, we had 1,690 advocates take action to generate over 2,000 letters to legislators. And all this hard work paid off when SB 1266 was signed into law in September. Next slide, please. Okay, so in review, you can visit the Action Center at aafa.org/engage and click Join Our Action Network to sign up. And if you do that, you'll start receiving emails whenever there is an important policy issue federally or in your state, and you'll also be able to take action on those issues. And I think that's the end of my presentation, so we can see if Caroline's back on the line.
Yeah, I don't think Caroline is here. I know that she's out in Nevada and they were having some windstorms out there, and so it could be that somehow her internet connection got disconnected, so we're going to hope that she can log in shortly. But in the meantime, I know a little bit about what Caroline did. Not in this, I can't tell her story like she can tell her story, and I know Charlotte knows Caroline's story a lot. So maybe Charlotte and I can kind of tell you the wonderful things that Caroline was able to do in her state of Nevada to actually get a mandate for stock epi passed. Charlotte, would you mind unmuting yourself, and we can kind of try to tell Caroline's story for her, and if she logs in, then she can pick up where we leave off. I'll get started. So, so Caroline is a wonderful advocate in the state of Nevada, and she reached out to her state senator and found a true advocate for children with food allergy and anaphylaxis. And based upon her conversation with her state senator, who I believe is Senator Debbie Smith, she was able to hook up with a lobbyist, and the three of them worked diligently with a group of advocates in the state of Nevada to actually champion this legislation and get it passed in rather short order. So, so Carolyn just was an inspiration, and she really took the lead on things and got this team assembled to actually get this legislation passed. Charlotte, would you like to add to what I just introduced?
And my apologies, I was on mute. She is actually calling in on the phone, so she may be with us shortly. Caroline,
okay,
if you
great.
can hear us, you just need to click the telephone access code, I think, or enter the access code is what I recall calling in from the phone. But you know, back to what happened in Nevada, it really took a lot of leadership from Senator Smith, and identifying a key senator like Senator Smith, who helped the advocacy team make decisions, was really a big factor in their being able to get a strong bill passed. And they did pass a strong bill. The law they passed was a law requiring epi-stocking in the schools, which was one of the first of the few that have been passed. They did note that passing this law was not easy, because when a state requires schools to stock epi, there's a fiscal impact. And one thing about state laws is if that you run into a cost or expense associated with it, there are going to be some issues with the budget, because states are really kind of limited in what they can do budgetarily. And if they do too much to add expenses to the budget, they have to raise taxes, and everyone knows how popular that is. So they actually ran straight up against this in Nevada, but they were ultimately able to get this passed. And one of the things that I really enjoy about Caroline when she's telling her story is that she's got lots of pictures of herself and other advocates, and especially kids, that they got engaged in this entire campaign. And the children helped to deliver their message in a really compelling way. And she's kind of written the book on how to use children to engage with their messages. There's a picture of the governor with the kids. So that's a picture of Governor Sandoval signing the bill with the advocates, including the kids, right up front. And they did a really effective job in telling their stories. And I'm going to shut up for a minute to see if she has been able to join us. Okay, so because she's not with us, maybe what we should do at this point, Linda, is to switch gears and find out if we do have any questions at this point.
Yes, I can certainly ask questions. I just actually got on Twitter and sent Carolyn the dial-in information for the organizers and panelists, so I'm hoping that she'll be able to dial in a number and join us shortly. But in the meantime, let me see what I can go do as far as questions are concerned. And this is not exactly an advocacy question, but I know that you'll probably be able to give us some insight on it. Are private schools eligible to stock epinephrine that's not designated?
It depends on how the law is written. And the law would have to specifically include private schools. So that's something to think about as you're working with your legislative sponsor is to, and your team is to make sure that if you want private schools included, they have to be explicitly included.
Okay. Our public school system told us that it's against the law for them to prohibit students from bringing peanut butter into school. Is this true?
You know, I don't know.
Okay.
I guess it depends on the law in your state. One thing about state law is, let's see. One thing about state law is that there can be variation from state to state. So I don't want to be the one to say, no, it's not true, because it may actually be true in your state. I would say, you know, the best thing to do is to check with someone who's an expert in the law in your state.
Okay.
I hate to say it depends. People hate lawyers for doing that. I do too. But this is a good it depends. Right.
Yeah.
Right.
Yeah.
Can you hear me?
Yes.
I can. Thank you, Carolyn.
I'm sorry.
We can start at the beginning of your presentation.
Yeah. Oh, thank you. And sorry, everyone. My internet completely dropped out in the house, so I couldn't pull up my email to find the sign-in and PIN number and the phone number. So Linda found me on Twitter. So I apologize. That's really odd. I've never lost the internet. Or I haven't, I should say, in months, so I'm so sorry.
That's okay. Can you see our screen, or are you unable to see our screen?
No, I can't at all. So.
Okay, well, we went back to your first slide that says, be the change you want to see in the world.
Oh, excellent. All right, well, I'm going to begin from there, and I know I missed Larissa. I'm so sorry, Larissa. But thank you again, everyone, for having me, and thank you to Linda and Charlotte, and thank you, everyone, for your patience. But, you know, the Gandhi quote just is one of my favorites because I really think it speaks to our food allergy community, because nobody understands managing life-threatening food allergies like we do. And for any kind of change to happen, it's our voices that need to be out there. And so I just very inspiring, because it just reminds me how we all need to be this change. And now the good news about the change in our food allergy world and all these wonderful things that we've seen is that all of us have a place here. All of us have a part. You know, I view it as a big machine, and there's cogs, and there's motors, and there's nuts and bolts and screws and all sorts of things, and all of us represent those parts. So some of us do big, loud things, and some of us do little quiet things, but we're all part of that, and there's a place for us there. And so I just think that, and I just believe too, that, you know, again, the parents are the ones that drive this. When we look at all these successes we've had, the heart and the soul is us. And so I'm really hoping when everyone leaves this webinar today, you realize how important you are in this process and how important AAFA is and KSA and just all the parts of our machine. And so I know they went over Nevada, because I was hearing part of it because I was stuck on this purgatory kind of mute place. So I heard part of this. I'll go through this a little more quickly here, but I do want to share what happened in Nevada and actually how we got started on this process. And it actually started back with Senator Harry Reid's office when everyone was working on the access to stock epinephrine, school access, the Stock Epinephrine Act. And I was speaking with Harry Reid's office, and his staff had suggested that we just go home to Nevada and try to get this bill going there, that it would be quicker and actually it can serve the children faster. So they said, you need to find a champion and, you know, do something in Nevada. So I started asking around business leaders, lobbyists, government relation folks, you know, who did they think would be the best champion of this, who would understand schools and the school system, has a passion for children, has a passion for healthcare. And unanimously, everyone said, you know, Senator Debbie Smith. So I sent her an email and said, you know, I really like to talk to you about protecting students, you know, at school with life-threatening food allergies. There's some ideas out there. There's some solutions. Can we talk? And sure enough, she responded, was able to meet with her. And when I met with her, I just laid it out. I had my top reasons of why I felt it was important. I know Charlotte spoke earlier about the little girl in West Virginia. That really moved me deeply. And so I shared that story, and I talked about other deaths that I felt were preventative, And that when I look at Nevada, I'm real concerned because a lot of our state is very rural. And even in the city, our ambulance response times are slow. And we actually looked at, if someone called 911, how long would it take? You know, how long would it take to recognizing a child's reaction and then to call 911 and get them there? So we actually had our talking points pulled together, and we discussed, yeah, you know, this is a problem, and this is something we can solve. So she suggested we create a work group, and we bring in all these different stakeholders of different entities that would be affected by this. So an example would be the State Association of School Boards. We needed to bring in school districts. We needed the nursing groups in there. And we needed just everybody that would be touched and impacted by this law, proposed law, to come together and discuss how could we make it work. What would be the problems, what would work, what would not work. And so she suggested we create a work group. So we started to pull together this work group. And during that time, I received an email from AAFA, from Charlotte and Leanna Burns, who's now back in college, inviting me to join a patient advocate workshop. And so it was right in this time zone here where we're just starting to pull everything together. And so I went to this workshop, and it was a patient advocate workshop, and it was just fascinating. I wasn't sure what to expect, but I thought, well, I'm starting to advocate. Let's do this. So I went to do it. I entered the room, and I was just so amazed because I had this vision in my head that to be an advocate, you had to be a lawyer, and you had to have all these degrees, and you had to be really smart and well-spoken. And I walked into this room, and it was an amazing assortment of people. There was a cookbook author, and there was a realtor, and there was a business owner, and a scientist, and journalists, and homemakers, and, you know, I'm a blogger. And it was a really neat cross-section of people, but everyone shared that same passion for food allergies and or asthma and making change with it. And at this workshop, I learned some communication skills. But the most important thing is I left that workshop realizing we can do this. We can go back to Nevada and do this. So I had spoken to Senator Smith, got our work group together, was absolutely jazzed after that advocacy workshop, and we were ready to go. And so hearings started because we were in an interim session, and that's where the legislators started exploring ideas and looking, you know, if this is doable, and conversations and testimony. And during that time, Michael Hackett, who Charlotte mentioned earlier, he's a government relations specialist and a friend, and now he's become a good friend. Now he is a dear friend of people with food allergies. But he offered his time and his guidance to help us work on this legislation. And what was really neat about Michael is he doesn't have children. He doesn't know anybody with food allergies, I think, other than my kid. He just really felt that this was the most important bill that he could see, and he wanted to be a part of that, and he wanted to see it through. He gave us one very important suggestion, was create a coalition so that all the volunteers from the state could come together with one voice, one goal. We could stay organized. We could keep our organization together and communicating with the same consistent message, the same talking points, and, you know, create an organized way to give our call to actions out there. And our coalition included several support groups, allergists, individuals, even some lobbyists down at the Capitol were very interested in this bill, and they wanted to be part of this coalition, and they wanted to be supportful. So it was really wonderful pulling together this coalition because that gave us, again, that strong voice and a launching pad to share our story. Also, with creating the coalition, legislators took us more seriously. So it wasn't just me, Mom Caroline, knocking on their door saying, can I talk to you? But I'm knocking on the door saying, you know, I'm part of this coalition. And it showed that we were serious enough to create a coalition and bring people together. So now during this interim session, and the discussions were taking place with the different committees, it really became apparent to legislators that we didn't necessarily want an authorized bill, but we wanted mandates. The concern they had with authorized is that not every student in the state would be protected and covered. And they really felt that a mandate was going to be fair and it would protect all the students. So when we got into session, we actually changed the bill and amended it and moved toward a mandate. And again, as soon as we hit the session and we were on the road to mandate, the group effort began. We all rolled up our sleeves. We all realized we were part of this machine, and we all just started doing our things. We emailed, we posted on Facebook, we sent out Twitters, we called people, we attended hearings, we provided testimony, and this was statewide. I mean, we do video conferencing here in Nevada, in Las Vegas and Carson City, and so we had people in Las Vegas testifying and people up here in Carson City testifying in person. We brought children, and children sat there. We packed the room, and one of the most important and nicest compliments I think we've ever received was from Senator Smith in telling other legislators during these hearings that we were the most pleasurable group to work with because we were very polite and we did what we said we would. So if she asked us to pack the room, we packed the room. I mean, we did everything that we said. And the process actually went fairly smoothly. I mean, still as a parent, stressful, but a positive stress because it means so much to us. So it was very exciting, but we went every step of the way through every single hearing and every single vote, and success finally hit. We were thrilled to death when we finally got the bill passed. And what was even more exciting, though, is within 2 months, I believe, the first life was saved. There was a message coming from Las Vegas, the Clark County School District. The student had an allergic reaction. The epinephrine auto-injector was given. The student showed immediate improvement before the ambulance came, and the story began. Then, a couple months after that, in Reno, a student, again, was in a cooking class, had a first-time reaction. Nurse grabbed the EpiPen, saved the student with it, and that was incredibly exciting because we were actually able to get a story on it, and it was discussed statewide. But the thrill of seeing a bill passed is amazing, but it's even a bigger thrill when you actually see it did what it was supposed to do. It was just amazing. So rewarding. I can't even describe it. But the 3 biggest takeaways that I want to share here with you in this whole process is the first thing is that our voices are desperate. Legislators have to hear from us. They can't make good law if we don't tell them what we need. And so we are so important. Again, I think as a parent, our voice is the strongest tool in this process. We just need to be heard, and they want to hear from us. They want to hear our stories. They want to hear why this is important. So that was the first biggest takeaway. Second takeaway was team effort. We're all a team, and we all have different roles. We had people in Nevada who were beautiful speakers, and they gave amazing testimony. We had people who are wonderful organizers who kept us organized. We had graphic artists who created the logo for our coalition. We had people who were wonderful with social media. We had people who just wanted to babysit our children so that when we went to hearings or meetings with legislators that we didn't have to bring the little ones, or if we needed school pickups. People were diving in just to do school pickups. So it's that team effort that really makes a difference. And then the third and last big takeaway here was communication. I've talked about this machine with the cogs and the motors and everything, but the communication is the oil. Communication is everything. This is the tool that we use to communicate internally. That means with our coalition, with other parents, with allergists, anyone who's sending emails and helping and are part of this movement. And then the other form of communication is the external, and that's out to other citizens in the area, trying to get them to see what we're doing. We're requesting that they join us and make phone calls. This is your communication to legislators or maybe the media, TV story, newspaper story. But it's the communication that goes outward. And when Andrew was saved in Nevada, I had met with Senator Smith, and later that day she was actually going to meet with Andrew's mother, and I had asked her if she could please get media coverage. Could we get a news story? Could we get a newspaper story? Because we need this documented, and we need to share this with the community and with legislators. And it was phenomenal. He hit the front page. It was all over the news. And the day that it hit the front page of the newspaper, my husband actually got a phone call from someone who was in the state legislature and said, oh my goodness, you should see this. Everybody is talking about this. You can't go down the hall without someone saying, did you see we saved a life? And so that is a form of communication, that information. And then later that week, there was a little news clipping where in our newspaper they list out like the quote of the week, and they had Andrew's quote, in there about how he was saved by it. And so that's communication as well. And again, that communication is that oil that keeps us all working. And I know Larissa mentioned California a little bit. That's when I was switching phone messages. So if I'm being redundant, somebody stop me. But I want to brag on California because I was just so impressed with how they handled their communication and their successes. California also created a coalition, the California Advocates for People with Food Allergies, and then within their coalition, they actually had a social media, expert and different people who did different things within that coalition. But they did such a stunning job of communication. And what I loved about their communication that's so effective is they kept everyone up to date, weekly, daily, sometimes hourly if it was in the middle of a hearing and they were doing something. They kept everyone very engaged. They provided actionable data. So if they needed you to write something, they gave you the email addresses or how to find it. They told you what to write. And then they called you to action. They told you when it was time to do something. They used Facebook, they used Twitter, they used emails, they had a website you could go to. I mean, it was amazing. And I wanted to share with you one thing they posted that I thought was just phenomenal. But to keep people engaged and to make things really fun is they posted this challenge. And I'm going to read you this challenge really quickly here. They wrote, got 6 minutes to make a difference? See if you can beat my call time. I called 9 assembly offices in 6 minutes. You can do it. Try it. See Connie's list of numbers. Ready, set, go. And then they gave you the line to use. I'm calling in support of SB 1266, the EpiPen bill, and I'm asking the assembly member to vote yes tomorrow. That was amazing. That was perfect. You knew exactly what they needed. They gave you the data, and they made it fun. They did a really good job of that. Also within the communication, they tailored their messages. So if they were speaking directly to a legislator and posting on their Facebook page to them or even face-to-face with them, they made sure that the information they were sharing would be relevant and interesting to them. And then they did the same thing with the food allergy community. So if they were trying to reach out to other food allergy parents, they would maybe explain the benefits of this kind of bill and why to get behind it. And so I was impressed, again, how they tailored that. They used really interesting graphics and photos. We all love that on, Twitter and Facebook. They kept people interested this way. They also shared their successes, and I think that's so important so that people know that their work is really helpful and it's valuable. And so it was really neat watching them share their successes, share with people how easy things were and how well they went. And they encouraged each other and they cheered each other on. And that's a big thing, too. It's really important to cheer each other on. We did this a lot in Nevada. We have constant love fest with each other because, it can be daunting and it can be tiring, and you're up late at night maybe doing something because, you had a full day. And it's really important to cheer each other on, really important to share successes and cheer each other on in other states and other advocates. It makes all the difference because we all need to know that what we're doing is making a difference, because that's why we're out there. So once we went through this beautiful process here in Nevada, I'm just, again, happy to share the story with you. But like Charlotte had mentioned earlier, it's exciting that we've got 9 states authorized. That's a lot to me. I mean, mandated. I'm sorry, 9 states mandated, and that's quite a bit, but we have a lot more to go. And so I really just urge and ask everyone, if your state's authorized, look into mandate. Let's start moving over. Let's start seeing how we can go there. For us in Nevada, our next step is actually to look at entity, which means businesses. I want to see stock epinephrine, and I know everyone else does in Nevada too, in stadiums. We want to see them at churches. I want to see them in camps and after-school programs and restaurants. And so now in Nevada, that's what we're looking toward and we're heading toward. But the biggest takeaway, in all of this experience for us here in Nevada is that, it's the soul and the passion of the parents that made this happen. I mean, it was just everyone going down to the legislature when they needed to, everyone making phone calls. It was just everyone just holding this so passionately in their heart and just pushing through. I mean, that's what makes the difference, is us. It's truly us. Even when we met with legislators, they would ask for us to bring the children. They wanted to hear the stories. They were excited to, and one legislator even had commented to me, what a breath of fresh air it is just to see real people with real stories doing things. So I just invite everyone to just, be part of that machine, be part of the cogs, and join us. And again, thank you for your time. Sorry about my whole internet falling out. I feel terrible about that. But thank you.
Thank you, Caroline. I think given that we've got about 9 minutes left and we want to make sure that we get in these questions, and I will just say anecdotally it's much better to hear your story from you than to try to hear it from me. So I'm really appreciative that you were able to share all of that. Why don't we go to some of the questions and answers, right? Some of the questions, and we can get the panel to answer. And I think Caroline really did help to explore this question really well, but I'll let you do maybe a summary comment on it, Caroline. Do you need to become an expert on the law before you visit a lawmaker?
Well, yes and no. You don't need to be an expert. You really just need to do some homework, though, and understand what it is you're asking for, in terms of what law you're looking for. But no, you don't need to be a full expert. Just do a little bit of homework. Actually, the advocacy kit should be very helpful with that and just understanding some of the basics.
Okay, thank you. And I want to go to the next question. Can you give me tips on how to approach my legislator? And Caroline, I'm going back to you on that, of course.
Yes, the best thing to do is send an email or pick up the phone and call the legislator's office, explain exactly what you would like. Understand they're very, very busy, so only ask for a short amount of time, 10 minutes, 20 minutes, not too many, and just say, I really would like to meet with you to discuss something that's very important to me.
Okay. Really important too, I know I've heard you say this time and again, to let them know that you are their constituent. You should get a better response from them.
Yes, that's a real key part of let them know to represent you.
Okay, great. Next question. My state has already passed an epi-stocking bill last year. What should we do now? And I think we've really pretty much explored that too, that if the bill only allows the state schools to stock epi, that you ought to try to look at going for one that requires the schools to stock epinephrine auto-injectors, and look at extending the bill so that other entities like the ones Caroline mentioned are included. How can we make sure schools have consistent policies in our state? And in parentheses, we've got New York. Let's see. Do either of you want to speak to that, Larissa or Caroline? I could share a little bit about where New York is right now after many years and many attempts to get some new state laws on the books that are statewide laws. New York has passed a couple of laws. The Assembly has passed, and the Senate, a couple of laws that would give students the right to carry and self-administer epi auto-injectors if they need them, and also a law that would allow epi-stocking in the state. And they're pending right now, and they're on the governor's desk. It's been a long slog. I know our advocates in New York can say more about this than I could, but it really has been a long slog to try to get some consistent policies, laws on the books, and different school districts have been kind of doing their own thing. So the best assurance of consistent policies is one comprehensive statewide law. Okay, next question. Are there any more? Okay. How can we best address loopholes in our state laws? Should we try to address these loopholes through our local school board, or should we try to fix it through updating the state law? Caroline, do you want to take a shot at that?
Yeah, I mean, I really believe you really need to keep everything very consistent on that, and so I would definitely address it on the state level. You can do your homework within the school level and understand these loopholes and understand where things are breaking down and come up with your solutions to then go back to your legislators and go back to updating that law.
Yes, and I don't think it hurts to talk to your local school board member if you have a member who represents you or the school board itself about the situation, to give them some flavor. I spoke with a school board member about a week ago who was really confused and uninformed about all these issues, and he found it really helpful that we had some resources for him and could explain it to him as well. But I would agree with you that going to the state level to get some consistent policies throughout the state is what will make the biggest impact. Next question. Or is that the last one? Oh. How should I find local supporters and influential leaders to support my bill? Caroline, do you want to do the wrap-up on that?
Sure. You know, really a lot of that is paying attention to when you hear about town hall meetings and any sort of public meetings or public forums and attending them, talking to people. I actually found my local newspaper reporters and editors really wonderful sources of knowledge of knowing kind of who's who and who does what. But a lot of it is just participating in any sort of public forum. I don't know, Charlotte, do you have other things to add that you may be familiar with?
Well, yes. I mean, for those who have not reached out to their own representatives, that certainly would be an early step too. And if you need information about who your representative is, you can research that online. But you can also go to our Action Center, and if you put in your zip code, we can link you to your representatives. Larissa, am I okay on that? Anything to add?
Yes, that's right. I would just say for local supporters, just kind of reiterating that I think social media is really important for finding others in your community who would also be interested.
Right, that's an excellent point too,
Great.
following someone, like your representative following them, or like I asked around, who's, supportive of education and healthcare, and then following them like on Twitter or Facebook.
Okay. Let's see. I think that's the last question.
Well, we have a few more that have come in that are related to the topic of this webinar, so I'm going to just ask. One was the link to your Engage advocacy site, and so we'll include that in the follow-up materials that we send. I can't remember if the slide at the end of this webinar includes that link again, but we will send that to you so you are sure to have it. Someone else was asking about issues with regard to school bus drivers and how they're not trained to administer epinephrine, and I know some states advocates have initiated legislation, work with their legislators to initiate bills to try to get bus training and whatnot, and I was just wondering if you wanted to comment on how to get that moving if you really want to get it going in your state.
And it may be, since most states now have these laws in place, it may be as simple as getting an amendment to the law or working with your local school district to try to get that training implemented. Most of the laws, statewide laws, do have training sections that involve training school personnel, and you may be able to persuade your school board or school district that that should include school bus drivers.
Mm-hmm. I think the issue is that many school districts use contract bus drivers, and so they may not necessarily have policies in place for the contractors. So that
Yeah.
needs to be addressed with the
Well,
school
you know, in a way,
district.
that almost makes it easier because if if the school bus drivers are contractors, then you just simply, and this, I'm going to make it sound easier than it is, but it's just a matter of getting the right language in the contract between the school board or the school district and the school bus company.
There you
So
go.
it kind of narrows your focus to your school board.
There you go. See, a good question for an attorney to answer.
Yeah, well, I actually mangled the other question that you asked me earlier about banning. You know, are there any laws against banning peanut products in schools? Because I know a lot of school districts are considering it, and some schools have tried to do that. And again, I really can't find anything, and I've sort of been searching while we've been talking, but I really can't find anything. There are some theories that relate to the Americans with Disabilities Act, but you would kind of have to stretch the act to say, to have it include banning peanuts in schools, and that would be in our favor. But the idea that you cannot do a peanut ban is something that I haven't found.
This, I think, is a state honor roll question. Where is the best place to find the actual law written for my state?
Yeah, that's a great state honor roll question. We have a website called statehonorroll.org that you can go to get a copy of our report, as well as an interactive map that shows every state, and for each of those states we have a profile of their laws, and there's some selected laws, mostly the ones that pertain to epi-stocking are going to have links included under those state profiles, so that's a kind of handy place to go. So it's statehonorroll.org.
Okay. And Laurel Francoeur is on the call, and she said that the Mystic Valley Charter School decision and other OCR decisions address peanut bans. So if any of you have links to those, you'd be able to review what the decisions were on those. We can probably include those in a follow-up blog post that we'll have. So with that, since it's already 2:03, I'm just going to go ahead and say thank you so much to our speakers, and I'm going to move ahead to the winners of our giveaways. So for our Sun Butter giveaway, our winners are Carmen Aguayo and Emily Serta. Thank you. Congratulations, and we'll be in touch to get those to you. For Libre Naturals, 3 winners of $25 gift certificates are for Jennifer Daly, Marcy Pyle, and Rebecca Huffnagel. And the last giveaways are for Pasha Chocolates. Sharon Schumach, you have won the Pasha chocolate bars, and Rebecca Huffnagel, you've won again for the chips. So I just wanted to thank all of you for being here today. I just want to remind you that we have some things that we would like to share with you. One is that the Balancing Act is going to have a 5 or 6 minute segment on food allergies tomorrow again, and you're welcome to join us on that show tomorrow at 7:30 a.m. We also will be posting a link on our Facebook page to the recording if you're not able to make it. We have some new Halloween resources that I think will be really helpful to you. One is tips for safely celebrating Halloween with food allergies. The page 1 is at home and tips for trick-or-treating, and then on the reverse side are tips to share with the school. So I think you should take a look at those and see if you can share that with teachers, preschools, whatever the case is. And then we have a new 2-page resource on non-food rewards for children with food allergies. And this is a wonderful new resource that's also 2 pages, and the first is no costs and low cost rewards, and on the back are rewards from the heart. And I really encourage you to take a look at that. That's another really useful resource you could share with schools and preschools. The archive of this webinar will be available next week sometime, and we'll send out a follow-up email with a link to the archive and other resources that I told you we would share with you. So In closing, I want to thank all of you for being here. Kids with Food Allergies, as I've mentioned, is part of the Asthma and Allergy Foundation of America, the nation's oldest and largest asthma and allergy charity. If you found today's session valuable and would like to see that we continue this webinar series, please consider making a donation to AAFA or KFA in your end-of-the-year giving plans. And with that, I'm going to say thank you for all of you joining us today. Thank you to Larissa, Caroline, and Charlotte for being our presenters today. And thanks for Melanie for running the show behind the scenes. Have a good afternoon, everyone. Bye.